Hello and welcome to G Fun Facts Online, where we explore the amazing science shaping our future. Today, we're talking about something that millions of people experience every single day: chronic pain. Specifically, a particularly nasty kind called neuropathic pain. This isn't your regular headache or a stubbed toe. This is a relentless, debilitating pain caused by damaged nerves, often described as a constant burning, stabbing, or shooting sensation. For a long time, the main line of defense has been medication, including opioids, which come with a whole host of problems, from addiction to losing effectiveness over time. But what if you could fight pain, not with a pill, but with your own mind? What if you could literally play a video game to retrain your brain to feel less pain? It sounds like science fiction, but it's happening right now, thanks to a revolutionary new field called digital therapeutics. These aren't just wellness apps you download on a whim. Digital therapeutics, or DTX, are evidence-based, software-driven medical treatments. Think virtual reality programs that help burn victims manage their agony, or apps that provide support for substance use disorders. This is serious medicine, delivered through technology. And in the world of pain management, it's offering a powerful new hope. The core technology behind these pain-fighting games is a technique called neurofeedback. It's a fascinating process that lets you see what your brain is doing in real time and then learn to control it. Here's how it works. First, a non-invasive device, an EEG, uses sensors on your scalp to read your brain's electrical signals or brain waves. These signals are then fed into a software program, which is often a game. The game gives you instant feedback. For example, maybe you see an animated jellyfish on the screen. When your brain produces brainwave patterns associated with relaxation and pain reduction, the jellyfish might swim calmly through beautiful turquoise water. But if your brain shifts into patterns linked to pain perception, the water might get murky. By trying to keep the water clear, you are subconsciously teaching your brain to produce the healthier brainwave patterns. See, scientists have found that people with neuropathic pain often have a specific brainwave signature, an increase in slow wave theta and fast wave beta activity, and a decrease in the calmer alpha waves. This disrupts communication in the brain's pain processing centers. Neurofeedback games are designed to correct this imbalance, essentially training your brain to turn down the volume on pain. A fantastic example of this in action is a new system called PainWaive, developed by researchers at the University of New South Wales in Australia. It uses a low-cost, 3D printed EEG headset and a tablet game that patients can use right from their own homes. In an early trial with patients suffering from severe eye pain, the results were astounding. After just 4 weeks of playing the game, 3 out of 4 participants reported a major reduction in pain, with some saying the relief was even better than what they got from opioids. They felt empowered, using mental strategies like focusing on happy memories to directly control their brain activity and manage their own pain. This game-based approach is part of a wider field known as brainwave entrainment, which uses external stimuli to guide brain activity. You might have heard of other methods, like binaural beats, where listening to 2 slightly different sound frequencies, one in each ear, causes your brain to perceive a third, phantom beat that can gently nudge it into a state of relaxation. There's also audio-visual entrainment, which uses pulsating lights and sounds to achieve similar effects. So, how solid is the science? The evidence for using neurofeedback to treat chronic pain is growing. A review of multiple studies found a clear positive link, with patients reporting not just less pain, but a better overall quality of life. It's shown promise for conditions from fibromyalgia to pain from spinal cord injuries. Of course, the field is still relatively new. We need more large-scale clinical trials to confirm these incredible early findings and make sure the results aren't just a placebo effect. Researchers are already planning these bigger trials for systems like PainWaive. The potential here is enormous. We're looking at a future with drug-free, non-invasive, and accessible tools that empower patients to take an active role in their own healing. As this technology gets better and cheaper, brainwave training games could become a cornerstone of a more personalized and holistic way to conquer chronic pain. Thanks for tuning in to G Fun Facts Online.